Hi, Dr. Matt Wise here from the Joint Chiropractic. I want to share with you how chiropractic works to both help you feel better and prevent arthritis. Look at this first spinal segment here on the left. It has lots of room for our spinal cord and for our nerve roots. Then, everything we go through and everything we've been through in the past takes a toll on these joints in our spine. Even just gravity pulling on them year after year makes our joints narrow and makes them less forgiving. And we end up with joints that either aren't moving or aren't moving correctly, both of which make them swell. That swelling or inflammation is fluid that collects and can build for a long time before we feel it. By the time that inflammation is pressing on the nerves enough that we feel it, the muscles are typically bracing as well. That places even more pressure and restriction around the nerves, and then it's in a vicious cycle, as you can see the openings for these nerve roots narrowing. If the cycle continues unchecked or unadjusted, then the discs begin to deteriorate and lose their support, which causes the bones to start to change their shape and form spurs to try to support themselves. And you can see these nerves being choked off here. These nerves are dying. So chiropractic adjustments break this vicious cycle. We get the joints moving better in order to get the inflammation and swelling down, to get the pressure off the nerves, and get the muscles to cooperate again. We unwind this nasty cycle in order to not just get things moving better and feeling better, but also to prevent them from getting worse, degenerating, and forming more arthritis. You see, when you're in that state of inflammation, those aches and pains that we tend to just push through, not only does it cause these symptoms, but that's also when the joints and the spine are going to degenerate and form arthritis and run into more disc problems, bone spurs, spinal stenosis, etc. That's the reason most of our patients come in about once a week, even after things are feeling fairly well, in order to not just keep things feeling well, but also to prevent them from degenerating, forming arthritis, and essentially getting old before we have to. People are so much more active later in life than they used to be, and we help ensure a good quality of life as we get older. By the time we feel symptoms, our joints have already been degenerating and forming more arthritis, eventually getting to the point where these nerves have died off. If you want to stay active and keep functioning as well as possible as you get older, keep up with your weekly adjustments, regardless of symptoms. Take care of your spine before it becomes problematic, and your body will thank you.